With us to unpack this further is Mr. Gary Lacasse, Executive Director of the Canadian AIDS Society. Sir, welcome to Forum Daily.
Thank you very much.
Now, according to 2018 figures, there are over 62,000 people living with HIV in Canada. But what are the most recent numbers so far, sir?
It's more like over 70,000 because PHAC has not increased the number since 2016.
Oh, interesting.
And having 2,000 and more infections per year, when you have the data, it comes out to more than 70,000.
All right, sir. Well, before moving any further, I think we should clarify the difference between HIV and AIDS itself.
Yeah. Well, HIV is when you have the infection. AIDS is what's developed from the infection if you're not in treatment, and that leads to death. So HIV is considered a chronic illness now, but it's an incurable chronic illness. It's the only incurable illness in all the sexually transmitted and bloodborne infections.
And we know Dr. Anthony Fauci, he spoke on how the pandemic is diverting scientific and financial resources away from the fight against AIDS. So tell us a little bit more about this. How has the pandemic impacted research efforts?
Research efforts have continued because the funding was already engaged. What has stopped or has almost completely stopped is the testing. So getting people tested and into care and treatment has come to a halt, mostly across Canada, everywhere. So we are seeing, for the first time, incredible numbers of transmissions from mother to infant at birth that we haven't seen in decades. So we're really lagging behind, and it's going to take a few years to re-engage all these people that are not getting sexual health testing done.
And at the same time, we also have the issue of stigma or discrimination against the AIDS community. So what is the current environment when it comes to this issue in Canada, and what needs to be done to tackle it, sir?
Well, we know now that, and we've known for a few years, that if you take effective treatment daily, that you cannot transmit HIV anymore, so sexually. So that means that we are at the cusp of maybe getting to zero transmissions if there is enough funding that's put towards getting there. As Dr. Fauci said, the investment has to be ramped up for us to really have an effective front against it. So that's news in itself. And also we have PrEP that ensures that somebody who's HIV negative cannot acquire HIV from an infection from somebody who has HIV who's not on effective treatment. So there's a lot of tools in our toolbox, but we have to be more multi-level approach to how we do prevention and how we do care and support for people living in Canada. And that's where we're lagging behind in Canada, is care and support of the people living with HIV.
All right, sir, just about a minute left here, but the PM mentioned in his statement that those affected by HIV and AIDS are often facing economic, social, cultural, and legal inequalities. So let's touch on these issues here in Canada.
Well, that's the issue that we have, is that we're in a federation. So the province and territories are in charge of their own health departments across the country. So as we've said since the beginning of the epidemic, it's the social determinants of health that drive new infections up. So, and it's also not talking about HIV. So we need education, we need better social determinants of health, be it housing, food security, and harm reduction services for those who use injection drugs. And I think we can win this, but it will not be under this Prime Minister, who has not increased our funding since 2008. So we need to have a government that really engages with us in the community, because the community makes the difference. And UNAIDS understands that and has been trying to get governments on board, because there are still almost up to 1 million people dying of AIDS around the world per year.